What if bunion surgery didn't require crutches, casts, or months off your feet? Most people have no idea this type of minimally invasive bunion surgery even exists. A lot of patients delay treatment for years because they've seen traditional bunion surgery recoveries and they think, I can't go through that. But minimally invasive bunion surgery has completely changed the recovery and what it can look like for many patients. I'm Dr. Lance Reeves, triple board certified foot and ankle surgeon, and today I'm going to explain what minimally invasive bunion surgery actually is, why some patients are walking immediately afterward, why I perform this without permanent hardware, and who may or who may not be a good candidate. Now, before we talk about surgery, it's important to understand what a bunion actually is. A bunion isn't simply a bump on the side of the foot. It's actually a structural instability where the big toe gradually shifts out of alignment. People spend years trying to manage this with wider shoes, padding, sleeves, orthotics. And while those things can sometimes help symptoms temporarily, they typically don't stop the deformity from progressing. Eventually, many patients start noticing pain every day, difficulty exercising, trouble walking long distances, or avoiding certain shoes entirely. That's usually when they begin to explore surgical options. One of the biggest reasons patients avoid bunion surgery isn't the actual bunion itself, it's the fear of the recovery. A lot of people picture large incisions, crutches for months, months off your feet, painful hardware, or long recoveries that interfere with their day-to-day lives. And honestly, for most traditional procedures, those concerns are understandable. But this is where minimally invasive surgery has changed the conversation dramatically for many patients. And this is the part that surprises people the most. Patients are often walking immediately after surgery in only a surgical shoe. So, what exactly is minimally invasive bunion surgery? A minimally invasive bunion surgery is a procedure designed to correct a bunion deformity through the smallest incisions possible. Now, this means the incisions are often only 2 to 3 millimeters. That's significantly different than a traditional open approach. One of the unique things about the specific technique is I perform it without any permanent hardware. This means there are no plates, no screws, and no pins sticking out of your toe. One of the most common questions I get is how can you correct a bunion without hardware? The correction is maintained through precise bone positioning and post-operative splinting while the bone is healing in the corrected position. Because there's no permanent hardware remaining in the foot, many patients appreciate avoiding some of the irritation or discomfort that hardware can occasionally create. Again, every case is different, but for the right patient, this can be a powerful option. And here's another thing that many patients are surprised to learn. This procedure is performed under local anesthesia. This means only the area around the bunion is numbed up prior to the surgery. Patients are fully awake during the procedure, and because we're avoiding general anesthesia, patients are often able to move through the surgical process much more efficiently. I also perform these procedures in my office surgical suite, which creates a much more streamlined experience compared to navigating a large hospital or a surgery center. For many patients, that lower stress experience matters just as much as the procedure itself. Now, one of the biggest misconceptions is that walking immediately means recovery is effortless. And that's not true. Surgery is still surgery. There is still swelling, there is still healing, and there are still post-operative instructions that patients need to follow carefully. But many patients are genuinely surprised by how manageable recovery can feel compared to what they expected. After surgery, patients are typically walking immediately in a surgical shoe. The bunion is splinted in a corrected position for approximately 6 to 8 weeks while the bone is healing. And during that process, the goal is to minimize the overall surgical footprint while still achieving a meaningful correction. For many patients, this can mean less downtime, less swelling, less pain, and a faster return to normal activities compared to more traditional open procedures. Now, it's also important to understand that not every bunion is the same. Some patients are excellent candidates for minimally invasive correction. Others may require different approaches, depending on the severity of the deformity, the level of the arthritis, the level of instability, bone quality, or prior surgeries. That's why individualized evaluation is incredibly important. The goal is to never force every single patient into the same procedure. The goal is to determine what approach gives the individual patient the best long-term outcome. At the end of the day, the goal isn't just correcting an X-ray. The goal is helping people walk comfortably again, travel again, exercise again, play with their kids or grandkids again, and stop organizing their life around their foot pain. That's what matters. My goal with minimally invasive surgery is to improve quality of life with the least amount of surgical footprint possible. And if you've been living around bunion pain because you were afraid of traditional surgery recovery, there may be more options available than you realize. If you found this video helpful, make sure to subscribe, follow along on social media, or visit the website below for more information. Lastly, if you have questions, post a question in the comment section and I can always make a video to address your question.